Everybody, I'm Dr. Adam Mathews with Mathews Counseling. And every month we have different topics that we offer resources around both on our blog and on our YouTube channel. And this month it is February, and it is Black History Month. And so our topic for this month is around mental health in the Black community. And we have one of our amazing therapists here to talk about it. Bria White is here, and we are talking about this idea of generational trauma within the Black community, and particularly how that generational trauma uh, sometimes gets in the way of being able to seek help, particularly mental health help. So, Bria, tell us a little bit about, can you just help us understand generational trauma? What do we mean when we're talking about generational trauma?
Yeah, so generational trauma, a good way to put it just kind of quickly is just like a hand-me-down, right? But instead of
Yeah.
clothes, it's the issues, mental health issues, the things that people tend to not know a lot.
Mm.
It's stress, it's anxiety, it's just
Yeah.
negative coping mechanisms, even maybe.
Yeah.
Yeah, so generational trauma, just things that just unfortunately begin to pass on from generation to
Yeah.
generation before anyone can stop it.
Yeah, I think that's a great way to talk about it. We talk about it in terms of what we see from our parents, we typically take on, right? And so we can only heal as much as our parents have healed,
Mm.
and the people around us, the adults that are in our life, have healed. And so that tends to get passed on. There's also a ton of new research out there about epigenetics, about the ways in which we physically, like in our DNA, how trauma affects our DNA and affects our bodies physically, and then that does get passed on to our kids. That's not the topic of this post, but or this conversation, but there's a lot out there about that and how that gets passed on. So when we talk about that within the Black community, can you describe kind of the some of it? I feel like should be obvious, but I'm guessing for a lot of people, it's not that are not a part of that community. It's not as obvious. So tell me a little bit about kind of how do we talk about generational trauma within the Black community?
Yeah, so this is actually something I find myself talking amongst like not even just clients, but my friends and myself. We
Yeah.
have these conversations often. Um, so it starts with like some people can look back as far as like grade school, for instance. It starts with things such as microaggressions, just kind of becoming accustomed to seeing things happen. It could be
Yeah.
something, I don't want to say as simple as, but as common as being followed around in a grocery store, right? Or a
Mm,
store or anything like that, and thinking that's normal. And when
mm,
people begin to normalize these not great behaviors, they're not realizing that they're internalizing the
yeah.
racism or just discrimination in general. And this is how generational trauma just kind of begins, I would
Yeah.
say, well.
Yeah.
And there's also just the common theme of being resilient, right? We always hear that word, especially being from New Orleans, that's like the word of the
Yeah.
city.
Yeah.
Um, but that's also very common in the Black community as
Yeah.
well. It's just like, okay, well, hard times happen. We've made it before, we'll make it again,
Yeah.
instead of coping with what's actually
Mm.
going on.
Yeah. It sounds like sometimes that word resilient, and please tell me if I'm right in this, that the word resilient gets confused with having to push through rather than to deal. Is that
Mm,
like it to manage?
exactly.
Does that feel accurate?
Exactly. Yeah.
Yeah. And I mean, that has got to take a toll, physically and mentally,
Mm,
when you're forced into positions where you have to continually rise up to push back, to push through. That's not really resilience. Like, I
it's
mean,
not. You're not
right, Debbie,
actually
would you agree with
healing.
that? I mean, yeah,
Right.
it is, but it is in one hand, but on another hand, it's not.
Mhm.
Like, tell me about how,
It's
if
kind
that
of
feels
like a
true to you.
band-aid in that aspect because
Yeah.
you're not
Okay.
actually fixing the issue.
Yeah.
When I think of resiliency, I think of the ability to move past things, but in a healthy way. We're
Yeah.
actually dealing with whatever the issue is instead of just like, well, you gotta keep it moving, stay strong, those things.
Yeah.
Do it ourselves type of thing. Sometimes it's okay to get help. We don't have to always
Yeah.
do things ourselves. And that's a very common sentiment within the community as well.
Yeah.
Let's figure it out ourselves, but not using the community.
Yeah. Well, and does that bleed over into not using mental health resources as well as often?
Exactly,
Yeah.
exactly. And not
Yeah.
seeking that external help has been kind of embedded within the community because there is that lack of distrust and just kind of just
Yeah.
overall not knowing who's going to actually have best interests in heart.
Yeah, that's got to be really hard because I mean, I don't think we can talk about generational trauma within the Black community without talking about the deep-rooted nature of not just racism, but coming like slavery itself, the history of
Yeah,
slavery, particularly in America, is so deeply, like we're not that far removed from it, right? Like it's not like it's that piece of it still resonates, and so there's a lot of distrust in systemic institutionalism, right?
right.
In any kind of institution and any kind of organized, like it again, please correct me, because like, but it seems like an organized mental health system, like an
Mhm.
institutional mental health system, there would be a lot of distrust there, and that makes so much sense.
Yeah.
Why would be there?
Even when it comes to just like going to the doctor for simple checkups. I grew up hearing about medical racism, learned about it
Mm,
more going to school. But that is still a very common sentiment within the
yeah,
Black community, especially amongst the elders who are supposed to kind of be leading the way and showing us, okay, go get checkups and things. But when
yeah,
those people themselves don't trust the institution, they don't teach those healthy habits such as going
yeah,
get checkups and things like that. And mental health is one of those things that need to be checked up on as well.
yeah. That's such a good point, and that's one that I think, because when you don't have that experience in the same way, it's kind of, it feels, well, what are there what are those barriers, and why can't those barriers be easily overcome? And what I'm learning, and what you're confirming, is that no, those barriers are very real and they're very high, and they're difficult to get over. And so that's part of what we're trying to talk about a little bit. So tell me a little bit about, how do we help people get over those barriers? How do we help help people in the Black community get the mental health help that they need, to address some of these generational traumas, to address any trauma that they have? How do we kind of lower those barriers? How do we help people get over them, and how do we do it on our side of things, from like being a group practice, a mental health practice, and then how do we help other people kind of come over them as well?
Yeah, so I think it starts as simple as having conversations
Mm,
amongst one another, especially in the community. And it was something that I've talked about even prior to becoming a therapist, and I talk about it more, educating yourself. Because sometimes there are people who prefer to get their knowledge from books because they don't trust the word of someone else.
yeah,
And that's okay, confirm,
yeah,
verify, always verify things.
yeah, 100%.
Have a support system, seek out therapists, not only who may have a shared identity, but even cultural competent therapists, because
Yeah,
we know there's not as many Black therapists available, but that doesn't mean there won't be other therapists who are culturally competent enough to help and just hold that space for
yeah.
the particular identity issues that a client may present with.
Yeah, and there's always that I like what you're saying about kind of, you're essentially trusting but verifying, right? That verification piece is that a lot of people don't know that you can basically interview therapists, right? Like you can
Go to
sit
lots
and
of
go to lots of therapists, check out ones that you feel like you can trust, that feel like that either have similar cultural components as you do, or are able to very quickly do the things that allow you to trust that they're going to take care of that part of you.
Mhm.
I think that's really important, something that that people don't know about. How would you, when you, because it feels like education is the key, right? Like educating yourself on
Yeah,
therapy and mental health, not just options, but on how it would be helpful as well. And so how do we go about doing that? How would you recommend somebody going about doing that when there is such a big distrust of mental health in general, but that's with everybody. But then you add on these components for folks in the Black community, and then you have to be able to do the work necessary. It's already hard enough to pick up the phone and call a therapist, right? So
right.
how does a person go about doing that work that allows them to have confidence in taking that step?
I think just trusting in the process is really the main thing people should do. And committing to, okay, whatever it is that's making them seek that help once they decide,
Yeah,
okay, you want to change something. There's a reason why they decided, okay, enough is enough. I
yeah,
like to think, okay, maybe you saw generations of people before you and you don't want to continue that yourself. You've
oh,
decided that, like, okay, I'm not going to be like a grandparent. I'm not going to be like a parent or an uncle or aunt and just decide, hey, I'm breaking that cycle. I think that's when people really decide to make those changes and just identify, okay, how have you been handling this stress, this burnout? Do you want to have better ways to cope with this now? Like, do you want that better quality of life for
yeah,
yourself? And are you willing to trust that, the professional that you're seeking can help you in that?
yeah. I love what you're saying about just recognizing that generational trauma exists and that you don't want to continue that. You don't want to pass that forward because that's really the only way to break it is
Mhm.
to do the work for yourself, like we were talking about in the beginning, and that allowing that to be your motivation. I think that's so huge. Bria, this is I could talk to you for a long time about this. So, tell me, what's the one thing you really want people to take away from our conversation?
That generational trauma happens, but it doesn't have to continue. The
Yeah.
cycle can be broken. I know a lot of people think since things are the way they are, have been the way they are, that they must continue, and that's just
Mhm.
not true. It starts with us as individuals and wanting to be that change that we want to
Yeah.
see.
Thank you so much. Thank you so much, Bria. I think that's a great something that's great for anybody to take away from, but especially folks in the Black community. So appreciate that. Happy Black History Month to you, to everybody out there. Happy Black History Month. Educate yourself on this very important time, this very important part in our this scar in our history that is still working its way out, that we're still having to really fight for equality among everybody, and being able to help folks get the care and the help that they need. So use us as a resource as you need. We have tons of therapists on our webpage at Mathewscounseling.net. We are really committed to helping you get into the right fit for the right therapist for you, and to make that process as easy as possible, and to make those barriers as less, to take them down as best we can on our side. So please reach out, Mathewscounseling.net. Bria has openings. You can request an appointment with her or another one of our amazing therapists as well. Bria, thanks again. Enjoy Super Bowl weekend
Awesome.
in New Orleans. All right, and we'll talk to you later, everybody. Bye.